Do you find that going in, that Black people tend to have more confidence in you just because you're Black?
Yeah, absolutely. Yeah, there's been multiple studies that have shown that patients, they relate better and they have better outcomes. They do better when they are treated by providers that look like them. So I certainly see that in my practice as well.
Right, right, and I see that in mine. And there was a recent study that showed, like, if there was an increased number of doctors Black doctors in a county, that all Black people did better within that county. Not just whether they came to us or not, just having an increased number of Black doctors had Black people do better. So just being in the area and just being in the room, and so, with this affirmative action, and I always talk about, I am definitely a product of affirmative action. Like, I don't know that I would have gotten into medical school without it, to be honest with you. Of course, once you get into medical school, affirmative action went out the window. There was no affirmative action while I was in medical school. It was all almost whatever the opposite, deaffirmative action, whatever. Right? But right now, it's with us needing more Black doctors, and then affirmative action sort of reversing it. Do you see that as counterproductive?
Yeah, it's definitely a one of those things that is we're faced up against. Our patients are diverse that we treat. I mean, you can't have a homogenous provider base that would serve in a diverse patient population. So this affirmative action, all these changes, I think it's going to negatively impact medicine overall.